Hi, thank you for joining us today. I am Haley Gardner, Chinese medicine practitioner and medicinary specialist here at Estuary Herbs. And today we are going to be having an exciting conversation with Dr. Rachelle Poffenberger. She has been a colleague of mine for many years. She and I went to Chinese medical school together and have been collaborating in a variety of different ways ever since. So let's see if we can get her in. Hi, there you are.
Hi.
Welcome. Thanks for joining us today, Rachelle.
Thank you for your patience.
Absolutely. Yeah, we had a little bit of an app update issue, which is always frustrating, but that's okay. So you should be able to see, this is a little bit of information about Rachelle's practice location. She's coming to us from Nashville, Tennessee area. And yeah, I would love to just have you tell us a little bit about your practice and a little bit about what got you interested in Chinese medicine. Well, why don't we start by just having you introduce yourself. Tell me a little bit about your practice and kind of how it has evolved into the shape that it is today.
Yeah, so as Haley already mentioned, I'm Dr. Poffenberger. It's kind of it's kind of a transitional story all in its own, because up until this point I have been writing under the professional name of Dr. Smith for probably about 10 years, well, 12 years now or so, and I'm just now changing it over, even like across state lines. So Poffenberger is actually really difficult for me to get used to, which is why I just pretty much introduced myself as Rachelle. So anyway, I'm Rachelle, and I am an acupuncture physician, clinical nutritionist, and herbalist. So, and I've been working with Haley for the past few years and Estuary Herbs, basically like cultivating an in-home practice. I moved my practice from Orlando to Nashville about 3 years ago, and then just having to continue care from there. So acupuncture became a vital service for pain management, for helping with insomnia, for a lot of issues with anxiety that we're seeing and depression creeping up, more and more people not feeling comfortable even leaving their home because of immune conditions. Yeah. So a lot of places that Chinese medicine has been able to be of service and become like kind of an essential part of our healthcare system at this point, in my opinion. I don't know.
Yeah, I think that's incredible. I agree. I've seen in a lot of ways, when the healthcare system in this country and everywhere really has become so incredibly taxed and just doesn't have all of the resources and support that it needs, or even the tools in the first place that it needs to holistically deal with the pandemic, with some of the ancillary things that are coming up. Like you said, people having these surgeries, surgery need doesn't stop because hospitals are full or because other crisis is happening. But it really allows, I think, people to be a little more open-minded about pulling in other supports, or even just space to recognize, oh, there are some holes here that could be supported really beautifully with other types of modalities. And I think it's allowed Chinese medicine to kind of shine a little bit and have the opportunity to show what we can do and how we can help with all of these things you're talking about. I think that that's really important to recognize, and kind of moving forward too, just allowing us to continue to have our voices out there and remind people that, hey, it's not just, it's not just acupuncture for pain in a clinical setting, right? There's so much more, whether insurance wants to acknowledge that or not.
So much more.
Yeah. Yeah. So are you doing a lot of, is the primary kind of way to work with you in home at this point? Are you still doing clinic hours as well?
I am all over the place. When I moved to Nashville, I helped start up a community practice as well as working on my in-home private practice. And through that community work, it was kind of like you said, like, Chinese medicine does offer a very nice, a very good, convenient way to offer Chinese medicine in a sustainable aspect. And acupuncture is really, that's a really great place for it to be. But there's so many other aspects to Chinese medicine that we almost need to be like infiltrating all different aspects of healthcare, you know, from walk-in community clinics to in-home care to being in the hospital as an adjunct physician, helping with neurological cases, helping with complex immune cases and things like that. So, but yeah, now that I'm moving out of the community sector, have more time to be able to offer in-home, but then I also have an office space because I am diligently trying to find a way to offer what we do to as many people as possible. And sometimes, you know, there is like a cost barrier when it comes to in-home care. I'm working on it. I'm working on it really hard. But in the meantime, as I'm transitioning, I'm finding for some people, it's still easier to meet in a clinic, in a clinic setting, and I'm able to offer a lower cost in an in-clinic setting. So it's
absolutely
trying to have a win-win both ways, and whichever way we go in the future, we'll transition when we get there.
It's just bouncing back and forth based on what needs are kind of more prevalent at the moment, right?
Yeah, exactly.
I think that's kind of what we do. We operate in seasons and cycles, and we recognize what's going on in the moment, and we respond to that. And it might change tomorrow, but it's kind of the nature of, I don't know, I think how we've all been trained, we being Chinese medicine nerds.
Right. Yeah, no, absolutely. I mean, this medicine started, at least from my understanding, its integration into Western medicine was through a very creative effort of like public health crisis, you know?
Yeah, through the AIDS pandemic.
Came against a public health crisis and said, hey, what do we have available that is cheap, that we can replicate, that we can teach some self-care health habits and be able to offer something that's safe, that's not going to have the same kind of side effects. And you know, I think we're finally kind of getting back to that. We strayed a little bit with social media pushing wellness on everybody, and you know, Chinese medicines, you know, fit in that, and herbs being like a wellness thing. But we're getting back to health, I think.
Well, that's a really interesting point, right? Because it's so much of the reason for that kind of tip into this sort of watered down wellness sector, I guess if you want to call it that, it is due to censorship and what we're allowed to say publicly and what we're not, you know. And I personally, that's something that I think about all the time. It is one of the most frustrating things in the world to me, because every day someone, you know, on a platform where I have a voice and an audience of people that are paying attention and listening and want information, someone asks you publicly what you can do to just, you know, talking about fertility, right? Talking about what can I do to support my fertility? Well, I have to say, well, we can support your reproductive health and balance and these things. And I'm not allowed to say, yes, I can treat that.
Right.
It's illegal for me to say
that.
Oh,
I know. My disclaimer forms are riddled with just, they're so long and I hate them. And I'm just like, you know, we got to get through it. We got to get through.
You kind of hand them to the patient with an apology.
Yeah, exactly. I mean, it's funny you mentioned that, because like working in the community clinic that I did work at was corporate run. And so one of the things I learned was all the legal ramifications against our practice, against our medicine just in general, and how careful we really do have to be when we talk to patients. When we have, from what I understand, the longest master's degree in the United States, like hour-wide, hour for hour and credit for credit.
Yep.
And it's and yet for some reason, you know, we still get lots of questions and stuff, but you know, it's such a strange society that we live in. You know, I think in a sense, people are starting to really wake up to recognizing what the official, you know, kind of language around something isn't necessarily the truth of it, and starting to ask questions and do their own research and kind of have those private conversations. And that's, you know, that's where we shine anyways, is through customized personal care for patients, right? That doctor-patient relationship. And I know that that's something that's really precious to you, something that you really focus on cultivating a lot, is that kind of one-on-one, built over time relationship with your clients, that kind of has its roots in some of those traditional practices, but also brings in that kind of modern concierge medicine
I don't know, theme. Would you like to speak to that a little bit and kind of talk
Yeah.
about
Well,
how
I
it's
think
shaped?
that, most of my practice for probably about 7 years was almost exclusively fertility, just almost
Mhm.
exclusively. And when you focus in on reproductive health that way, we're typically with patients for a minimum of a year and a half, 2 years. Like that's our average with fertility patients. And I don't think most people realize that when they come to the acupuncturist for their fertility
Yeah.
issues, because people are coming to us usually once they have already had their blood work done, already been told that from their fertility endocrinologist that there's some reason they can't get pregnant, but they don't know why.
Mhm.
So we're kind of at I wouldn't say losing end, but we're at the tail end of it. And it does take a while to kind of get the body and the vitality back.
Right.
But so you cultivate a relationship with the patient. And
Mhm.
because of that relationship, you're able to recognize when something's not right, recognize when something's out of balance before it gets to the point where it's causing symptoms or causing illness.
Mhm.
And what I found was that, those patients, they did continue with me throughout their pregnancies or their births and postpartum, because they had that trust already built up, not necessarily because of my expertise in that area at
Mhm.
the time,
Mhm.
but mostly because they knew that I knew their body enough and I knew those nuances. And through the process that I usually go with patients with reproductive care specifically, I'm teaching them about their body. I'm teaching them how to recognize different changes in it, different transitions, if you will, that it's going to take, and then kind of giving them a heads up through the eyes of Chinese medicine, what we expect to see in the next 14, 28 years, and so
Mhm.
on, based off of how they're taking care of themselves now. So
Yeah.
having that model, it's easier to be able to kind of, just check in every year after that or every 6 months and be like, hey, how am I doing?
Mhm.
You knew me for so long. It's kind of like having that family practice physician that you've known since you were a kid, and so he knows about all the stuff you got into in your teen years. You can't lie about any of that. And it's
Absolutely.
important it's important when you're visiting them and you're letting them know about the different health challenges that you're having, to have that medical history behind you, even in
Mhm.
alternative medicine.
Absolutely. I think that's something I remember. I remember when we were in school learning about the concept that traditionally the Chinese medicine physician would go into the home of the patient and diagnose the family, work with the family, learn the dynamics between the family members, assess the environment of the house, look at the food that they're eating, the ways that they're cooking it, the preparation, like all of these things, like truly holistic kind of sense of what's going on and what's contributing to the health or the disease, if I guess is what's happening of the patient, and kind of formulate a treatment plan from there. And often it included the whole household.
Yeah.
And,
Yeah.
it wasn't just here, take this pill, or even here, take these herbs. It was the lifestyle practices, the emotional practices, the kind of that mind body aspect, and the herbs and the acupuncture, depending on what's going on and what's necessary. But it sounds like you really are working to kind of embody that type of relationship with your patients, which I think is where the power for change really lies. If we're
Oh yeah.
just dealing with the tip of the iceberg, it's like, yeah, you'll get results. We get results. It's not that taking herbs or just coming to an acupuncture treatment isn't going to give you something. It absolutely will, but it's not going to be the full depth of what we can do. It's not going to
Sure.
create the lasting change. And like you said, kind of set someone up for success as they age, moving forward, kind of prevent those health things that could potentially come up. Which I think is a really cool thing about our medicine, is that, we do have that roadmap for, if you do this now, then the next season you will have health in this way. If you do this now, then in the next decade you will have health in this way. And that's incredible, right? I think that
Oh yeah, absolutely.
so many people don't even recognize that that's an aspect of this, right?
Yeah. Well, and I think too, when we bring up the word food, or we talk about dietary changes, or when we make little lifestyle suggestions, and to be quite honest, my when I do give like a treatment plan to patients and I include like lifestyle suggestions or dietary changes, they're pretty in depth. you know, I mean, they're going to be down to what would be an ideal environment, but it's not. I think everybody has this concept that when we're talking about food or we're talking about diet, that we're going to be rummaging through cabinets and we like start talking about carbs and proteins and things like that. And Chinese medicine is just so much different. It's so much more like eloquent in the way that it presents it. And it gives you options, like lots of different options in terms of how you can consume those foods and in which ways are going to be best for your body at that time. But getting the family involved is definitely, and seeing the dynamic of the family and being able to just let them know, like, hey, you know, you think your stress is coming from here, but from my point of view, this is what I'm kind of seeing. If we make some of these changes, you know, you can see that. And if you can't make those changes, here's the expectations.
Right. Kind of helping a patient to establish what, I don't know, I think to a certain degree, even what health looks like what is health, you know, that's something that I think in our culture, we don't necessarily have a really strong parameter for what is health.
No, and I think to that point also, I think we've been kind of like riddled with, like, I don't want to put a poo-poo on this, but we've been kind of riddled with coaches. Coaches from like every aspect of everything, and they're coaches for very specific conditions a lot of times. And I find that they can be really beneficial in cases where like the situation can match up the person and like really there is like, they find that there's a connection, but it's not a one size fits all. And I think when we think of health and we think of having a coach with us, we think of somebody who's just going like rah, like keep going, you can do this, really push you to do that. And when we talk about like food therapy or lifestyle coaching in Chinese medicine, we try to use our language very carefully, I think, when we're giving these diagnoses or these treatment plans, because we don't want it to sound like we're trying to push you into one way or another. We're showing you that there's an alternative, there's an option that you have outside of the current options that you've been given, and we're here to help you along that way, whatever that is. You need a coach, maybe, you know, maybe I'll rah. But at other times, maybe I'll just be there to hold your hand and kind of let you know what the changes are happening, so you can make those choices yourself.
Yeah, kind of just witness and hold space for the patient as they start to become a little bit more in touch with their body and their symptoms, the cause and effect of different things in their life, connected to some of the symptoms that they might be experiencing, that kind of thing.
Absolutely.
Yeah, I agree. And I think sometimes too, when we get too into the space of, well, I have this condition, so I need an expert in this condition, and that's going to be the coach that's going to get me out of this scenario or is going to help me manage it, you know, in I don't know, in a very specific way, it kind of stops us from being able to imagine ourselves free of those symptoms or in a different kind of health, in a different kind of balance.
Oh, sure.
I think that there's a lot of liberation in looking at things instead of from the Western view, kind of just pushing pause on that and setting it aside. It's still real, it's still there, it's all very relevant. However, it's a little bit limiting in a lot of ways. And if we can kind of set that aside and move into the space of, okay, well, what if I looked at this from a totally different perspective? Instead of standing over here in this holographic universe around us, what if I stood over here and looked at the same thing? Do I need to do the same things in response to it? What happens? You know, just being curious about that when we kind of set aside the idea that I have this condition forever. Instead, let's look at it from what's the state of my kidney yang? What does that look like? That's not a label I have to carry forever, but maybe it's deficient right now. What if we build that up? Then where are we? What happens if we stand over here and look at it, you know?
Yeah, I think a lot of patients, and I know we're getting like way off topic here, but that's okay. We have one of your questions, and we did have interview questions, and I'm trying to stick with them, but
I'll bring it back around. This is just interesting to me.
One of the questions was like, "What's your ideal patient?" And like it was like immediate in my brain. I could think of them. It's like when you're tired of Googling your symptoms. That's the patient. That's the one I want. I want the one who's like, I went and I Googled this, so I tried this. And now I have this cabinet full of supplements, and I tried this herb and I did this herb, and I went to this coach and I went to this coach, and then I bought this book. And you know what? Someone told me Chinese medicine, so I'm going to try acupuncture, and I'm here to try acupuncture. And I sit them down and I'm like, okay, we'll get to that. We'll get to the acupuncture. Let's just sit down and kind of unravel what's happening. Like when you're done trying to Google and DIY your own health problems, come and see a trained, licensed, board certified traditional Chinese medicine practitioner. Like, honestly.
No, absolutely. It simplifies things. I think, the word you used before was eloquent. Chinese medicine is very eloquent. It's very beautiful in its simplicity in a lot of ways. It's a huge and complex system of medicine, complete in and of itself in many, many ways. But also it's very good at distilling these millions of things. People come in with a grocery list long of symptoms that they apologize for when they hand it to you and say, I'm a mess. I have so many different things. And I would say, I don't know if you have this experience, but for me, 90% of the time I go down and I say, okay, well, these 25 symptoms are under the category of, again, just using this common example, kidney ion deficiency.
Yeah.
So that's all one thing. Great. We just took 25 things and squished them into one. And that's really empowering, right? That feels amazing as a patient, because then you don't feel like you're falling apart. You just need to tend to your kidney yang, right?
Yeah.
Okay.
Well, we hope that that's how it's getting across. When I first started practicing, like right in school, I remember like the first few patients I had, and they had that grocery list, right? It was like this big long list, but I knew exactly, like it lined exactly up with a pattern. And I would get excited, and I would be like, oh my God, I want to tell you so bad. I want to tell you exactly what this is, and it's going to blow your mind. And I've got a solution, or at least I have a few different solutions we can try,
Right.
And you have to hold back, you have to be like, okay, I understand. You've been in pain for 10 years. Yes. Right. Yes. And let's have a plan. But deep down inside, you're like, oh my God, that's exactly,
I can't wait to help you.
You know exactly what to do.
Yeah.
And I know exact pharmacy to grab it for you now.
Absolutely. Yes, definitely. Well, let's talk a little bit about your relationship with herbal medicine. I know that you have you rely very heavily on Chinese herbal medicine in your practice, and you have for a long time.
Yeah. So, well, my personal background in Chinese or in herbal medicine in general goes like way, way back. But I have recently been able to utilize a lot of those strengths in that training because of estuary herbs. So herbal medicine originally kind of came in access to us through for acupuncturists through the form of like pills and dried herbs. We would have, for those of you who don't know who've joined us, for Chinese medical practitioners who are also herbalists, we rely on a pharmacy that can actually compound these multiple herbs into one compound. And it typically takes, like, most of the time we're starting with a minimum of, I don't know, Haley can probably correct me if I'm wrong here, but we're starting with a minimum of like 7 to 8 herbs and like kind of moving our way up there if we're working with like a personalized formula. I know there's different limits for every practitioner, but also they are such unique formulas in a lot of the cases, because you have to understand that maybe like with my practice, it was easier because I was seeing fertility patients. So there's a lot of different types and patterns that come through for sure. And personalization still has to happen with every person, but at least I'm working with probably, at least like 10 to 15 base formulas, makes it easier.
Yeah, you kind of limited your scope.
Yeah. But with a family practice practitioner or somebody who's specializing in more complex cases, then, we're making formulas like left and right that are complex, and individual herbs have to be grabbed off the shelf. We can't make it ourselves. And it has to be done from a pharmacy that has access to a lot of herbs at one time, hundreds of herbs, sometimes from across the ocean for specific formulas, and sometimes not so legally. Oh, I shouldn't be saying that, but really it's difficult. And the reason is because we expect a certain quality, because we expect a certain outcome from our formulas. We're not trying to make you smell good. We're not trying to, help you like relax to sleep. Like, we want to make sure you're going to sleep. We want to make sure that your cycle is going to change. We need to know that there's going to be a change in progesterone and estradiol levels. We need to know that I'm able to change your cortisol levels. So we need to know that our herbs are going to work. And that has usually been limited to just something you can take orally. Now, working with estuary herbs, I've been able to extend that to things like topical formulas, which is something that has not been accessible before. That's a whole nother topic. But topical formulas, sitz baths, I'm able to use Chinese herbals in in sitz baths for patients, in wound care for patients. Whereas before this wasn't possible or accessible, or at least it was sketchy. So you weren't sure what you were kind of getting. Yeah. So yeah, I mean, it's kind of brought herbs back into my practice, like full throttle. I always have them with me. I always have like a tincture of ginseng with me. The midwives always joke whenever I go to a birth, they're like, did you bring an extra one for me? Because everybody else brings.
They all need it.
Yeah, I'm like, oh, next time I'll remember. But yeah, I mean, it's in everything that I do now. Everything.
That's one of my favorite things. You were one of the first practitioners that I started working with when we began Estuary Herbs, that really wanted to dive headfirst into the creative aspects of herbal medicine, and not necessarily just the oral formulas, but kind of saying, oh, I've had this idea. Can we make this happen? How do we do this? What is the delivery format that we could use to get this, into the body transdermally in this way or another? So we really got to kind of play with a lot of different creative solutions to getting herbal medicine to people, because everybody has kind of a different set of needs and a different set of challenges when it comes to taking herbs. And that's something I love to be able to provide. It's, I talk to a lot of practitioners that really, really struggle with compliance with their patients in herbal medicine. And personally, I mean, of course, there's some folks that are just not going to take the herbs. It's just how it's going to go, but that's okay. But personally, in my practice over the years, I really haven't struggled with that in the same way. And I think that part of it is just the way that you're communicating about herbs to your patients. And part of it is being able to recognize the appropriate delivery formats to get the herbs to the patient. And, whether it's internally as a tincture or a powder or a pill or a formula that is, sweetened, or I don't know, we have so many different kinds of things. Sometimes we're working with herbal oils and infusions and topical tinctures and all kinds of different stuff, but there's something to meet the needs of each patient. And it's really fun when practitioners want to just kind of unleash their creative brains on that, so we can kind of create the herbal practice of everybody's dreams. Because that's,
I think estuaries like functional tea line or functional food line has definitely been one of the major creative juices for TCM Concierge, and it's opened us up to be able to allow me to partner with a lot of different types of people within the community. I'm working with a chef now who's able to provide in-home postpartum meals, and
That's
also
awesome.
specific meals for anybody who's going through a time period where they need some help with that. But specifically those who are going through healing crises. I can think of a lot of patients who come back from GI surgeries that it'd be nice to have some healing foods prepared, instead of just be like, well, good luck, have some broth.
Right. Exactly.
And if that's not available, working with estuary herbs has made it available for me to compound. And I'll be honest, they're not tasty. but
not always.
I've been able to compound whole food powders that are giving patients all the calories and the proteins and the carbs and the vitamins that they're needing to get in through a whole food source, and not having to take it from a pill, or not have to take it from some weight loss powder, because that's usually what I have to work with. Right. And we've been able to work with these chefs to come up with some new recipes. Most patients they're compliant with it because it's not in the same form of taking medicine. It's become part of this ritual, part of this routine. And it's, it's easy to do. It's like an easy way to nourish yourself.
Yeah, and it's, once you start to really get into the routine, like you said, you create a ritual out of it and you start to really, I don't know, almost just appreciate and kind of crave that moment where you know that you're just taking this for you, you're doing this because this is good for you. This is you nourishing yourself. This is you connecting with, this sense that something was out of balance and you're doing something to create balance in your body. Like you're investing in yourself in a way. And I think that when we can turn that, kind of take it away from I'm sick, this is medicine,
Right.
to I just want to take care of myself and sort of I don't know what the word I'm looking for is, but it
No,
takes me
you're
out of that
right.
space.
You're right.
Mm-hmm.
You're carving out the space. I heard somebody talked about at one point. They were like, we get so caught up with this term, and coming from the point of view of a mother, this has been this kind of rang really hard for me, because we're always pushed to like wake up before our kids, create
Mm-hmm.
space for yourself, make a ritual of this,
Mm-hmm.
but I gotta tell you, some days you don't want a ritual. You just want really, really strong coffee, and you want some alone time, even if that alone time is just plugging some earplugs in or whatever it is.
Yeah.
But the I forget who it was or what I was listening to, but I remember they talked about what you're doing is you're creating a container wherever
Mm-hmm.
that container is in your day. It doesn't matter if it's a ritual, if there's something sacred around it that you've created, but you've created a box specifically for you. It's something you do just for you, not
Mm-hmm.
for anybody else, not for any other reason, and you don't bring guilt into that box. You just create that space for yourself. So that kind of like hit me really hard, because a lot of times I'll say, oh, I forgot to like drink this tea, or I didn't take that adrenal formula that I made for myself that I know I need right now. But if I would have just taken the time to say, okay, here's my container of time, my container of space, I'm not going to feel guilty for it. Everyone, maybe lunch gets put aside for like 30 more minutes, and I'm going to sit down, I'm going to take this, and I'm going to enjoy it, and I'm going to take care of myself for this little
Yeah,
bit of
just an acknowledgement of your you-ness, like your own needs, whatever those are. Again, adaptability, right? Like whatever
time.
those are in the moment, just that simple, like, hey, I'm acknowledging that I have a need in this moment. I have a need every day. I'm gonna be with me right
Right,
now.
right,
Yeah.
exactly.
Yeah, I know that's an interesting thing too, because I think kind of the same thing you were saying before about the wellness space on Instagram becoming a little tedious. It's, I think the concept of ritual has kind of gotten wrapped into that. So it is hard, you try to have these conversations and just use the language that makes sense.
Because
Yeah.
but you know
Well, I think that it all does come around. It's all a pendulum, and I think sometimes we swing really far in one direction because there's this new communication platform, and we're exploring life from another perspective, and we get sick to death of looking at it from that perspective, and it
yeah,
starts to swing back. And the goal is maybe eventually we find some kind of a
yeah.
balance in the middle, and it actually makes sense and serves the greatest good rather than just
Oh
kind of
sure.
sticking
Oh,
with the
don't get me wrong, I have loved all of the practitioners that have been putting up really great curated stuff. Like, it's
Mhm.
I don't think I'm ever going to create any content because of it. Just it really, like, I just want to keep taking pictures and resharing you guys' content, because why would I? Why would I try?
It's a weird place to be. I have a very mixed feelings about the whole, you know, internet presence in medicine, but I'm trying to embrace it at this point because I feel like it's a really good way to kind of start shifting how it's showing up, and kind of just getting the message out to people that want to listen. I think there's always going to be folks that aren't interested in going deep and really making profound changes. And there are always going to be folks that are just like, oh my gosh, there's truth in that. I feel something real in that. And it might not be what I'm seeing here, but I'm going to dive deeper. I'm going to
Yeah,
investigate. I'm going to have,
it gets them
real
curious for
conversations.
sure. Yeah, yeah.
Mhm. So coming back to my script here, because yes, we are definitely meandering,
Sure.
but thank you for this conversation. This has been really fun. I'd like to know a little bit about, I don't know, what are some of the biggest myths about traditional Chinese medicine that you find patients that show up in your practice really bring to the table? What would you like to dispel about that?
Well, I think the first biggest myth about traditional Chinese medicine, I think, is that it is acupuncture. I think
Mm.
that's been, and I don't know if it's necessarily like a myth, but I think it's just a concept. Um, it's kind of a strange one to me because in Orlando, coming from a state where we have schools, not just one school, but we have many schools
Mhm.
that
Yeah.
pump out TCM practitioners. We set up these practices and specialize, and so there's a lot of us around. And then moving to a state where there's not many, and we want to introduce patients to Chinese medicine, and we know that the easiest way to do that is to do it through acupuncture. and so
It's
and so
accessible, absolutely.
right, and a lot of the introduction is very strange, again, in a state where it's also legal to dry needle. So that introduction to acupuncture can come from a lot of different places, not necessarily just a traditional Chinese medicine practitioner. And
Mhm.
and education has been a big part of that.
Mhm.
So, you know, I'd say that's one of the biggest myths, is that just kind of it is just acupuncture. It's not
Mhm.
just acupuncture,
Mhm.
but that's a whole nother topic. And I think the second one is also that it is either like an alternative medicine, or it is, you know, I think some people come and they're like, well, I'm not really sure about taking this because my doctor has me on this plan, and I want to just stick with it. And I'm like, okay, that's not a problem.
Mhm.
What would you like me to do? Like, well, if I do this, maybe I'll just try doing some herbs and doing this, and then I won't follow what my doctor said. I'm like, well, that's not what I said.
Right.
This isn't an either or. This isn't an alternative to what you're doing. This is a complement. We can make this a
Mhm.
complement. We can make a healthcare plan that you're comfortable with.
Right.
And if you're comfortable, if one of your goals is to come off of your medication, then let's talk about what that looks like.
Mhm.
Or if your goal is to marry the two, maybe use less of it and be able to use more, to know when to use herbs comfortably, let's talk about that.
Mhm.
Let's educate ourselves on how to do that properly.
Mhm.
Because it doesn't have to be an alternative. It doesn't have to be, well, I use acupuncture for my pain management, but then I go to my endocrinologist for my Hashimoto's. It's like, well, but you're kind of,
It's all one body.
right, it's all one body. Exactly.
Yeah.
Exactly.
No, I think that's
Yeah.
a really good point. Oftentimes I mean, even you and I have used the term alternative medicine. We're so indoctrinated to that language. But it is. I think that creates kind of a misconception that what we do is an alternative to conventional Western care, which it's not. I mean, if I break an arm, I'm not going to go straight to my acupuncturist. I'm going to go get my arm fixed,
Yeah, and if
and then
you
I'm going to
come
go
to
to
me
my
with your
acupuncturist.
if you come to me with your broken arm, I'm going to send you to the
Right.
emergency room. Like, come on.
Yeah, exactly. And I might be taking herbs that are in my purse while I'm sitting in the ER
Sure. Oh
waiting,
yeah,
and I
absolutely.
definitely will. But that's just me.
Yeah.
But it's a complementary practice. And I think both sides of that equation have their pros and cons. And it's just about educating the population to kind of, and doctors, Western physicians to kind of understand what we do, what we don't do, and how we can work together to really serve the greatest health of our patients rather than kind of creating this divide. Oh, I do natural things. Oh, I do medicine things. That's
Right.
not
Oh,
useful to anyone.
or the patient that comes and they're like, I didn't tell my doctor that I came to see you. I'm like, why? Why? Why are
Please
you
do.
hiding me? It's so weird.
Yeah. There's a lot of fear around, I think, judgment and different kinds of things. And
Sure.
there's a lot of misinformation around what we do from the Western medical community because they don't really have any training or understanding. Whereas we go through a lot of biomedicine and things like that within our degree. they don't really go through the same kind of training about what we do. And of course, I'm not saying that we're, you know, highly trained in Western medicine as a primary care doctor, but we have a good understanding of the system, and we are trained to be able to interact with it very seamlessly and to understand the herb drug interactions, the, you know, acupuncture drug interactions, anything that's coming up, that's part of our education. Whereas I really wish that, you know, we can kind of usher ourselves into a space where Western doctors have a preliminary understanding of how we can support their patients and just serve everybody a little bit better for it, you know?
Yeah,
But
absolutely. Absolutely.
I think we're getting there. It's better than it was 10 years ago. I have to say, you know, it's changing.
Yeah. For sure. I mean, I don't think Medicare or Medicaid didn't cover, or Medicare didn't cover acupuncture 10 years ago, and it does now, you know?
Yeah, there are on staff acupuncturists in VA hospitals all over the country. That's the coolest thing ever. You can get a job working and serving veterans as the acupuncturist at the VA hospital, covered by, you know, VA benefits. Amazing. That was not a reality a decade ago. So we're getting there, you know, we're getting there. Well, I think, let's see, is there anything else that you'd like to kind of share with anybody that's watching about kind of how they can find you? You know, if they're trying to decide if they're in your area, if they're a good fit for working with you, what that might look like?
Yeah. So right now, the best way to get a hold of me is through my website. It is in a little bit of flux right now, so you're pretty much just going to be emailing me, but it'll be done in the next couple of days, and then they'll have a way to book services at my office in downtown Nashville, at the Lotus Center, and then also how to book in-home services. And right now, I have one slot left for December for postpartum services, because you do have to kind of reserve these in advance. And then I also do have 2 slots left for birth packages in November. So anyway.
Very exciting. That's awesome. Yeah, any mom is going to be lucky to have your support through that process. I think that that's such an incredible gift to be able to offer someone in helping to recover after just going through such a huge transition. I know that that is something that has been really important to you, and just kind of supporting folks from one transition to another. And
yeah, absolutely. It's fun.
Absolutely. Well, thank you very much. I do apologize for meandering off of our script a little bit here today. But
Oh, no. I think it was great. I hope everybody enjoyed what they heard. I hope there was like a lot out of it. I know we we can go on and on about a lot of different subjects. So anytime.
Definitely. I would love to have you on here again so we can kind of get into some more just rants and rambles. I think there were some interesting things that maybe we could loop back around to another time. I'd love to have somebody to rant with about the dry needling situation. That's something that would be a really fun one to get fired up about and let everybody
yes, absolutely.
kind of understand where we're coming from. Awesome. Well, thank you, Rachelle. I very much appreciate your time, and we'll do this again at some point soon. I hope you have a great night.
Absolutely. Thanks. Have a good night.
Thank you. Take care.
Bye.